Hello, I'm Dr. Caroline Jones. Welcome to our Wednesday night webinar for Wellness Dentistry. Tonight, I'm going to be presenting The Mouth is the Gateway, what every family needs to know about wellness dentistry. And I'm so glad you're here. We have a lot to cover tonight, and I'm just excited that everybody's here with us. So let me just share a little bit about who you're going to be spending time with for the next hour. This is me. I'm Dr. Caroline Jones. I have 31 years in clinical dentistry. And then I changed everything. I came down to Katy, Texas to actually train under Dr. Katie Toe because I didn't understand what I was missing. I'm a mom of two boys. I'm a musician. I certified with the IABDM, so I'm a biological dentist. And also just wanted to share with you what the whole body has to say about teeth and what teeth have to say to the whole body. Tonight is a conversation that I wish someone had had with me sooner. So tonight we're going to go over, and I want to just thank Dr. Katie Toe for letting me host this webinar for her. She is the president currently of the International Association of Biological Dentistry and Medicine. And she's here in Katy, Texas. She's the founder of our practice, and she is my mentor and just an amazing human being. I moved down here from South Dakota, so I'm going to share with you what inspired me. Back in 2022, I actually got in a vehicle accident, not my fault. Someone rear-ended me, and I ended up, that was December of 22. In March of 2023, my tooth had gone crazy, and I ended up having a fracture. So, of course, as a dentist, I didn't want to actually lose any of my teeth, but unfortunately, it happened. I lost a tooth. And so through that journey, my bite shifted and I needed some help. So I knew that I needed to do this on a very holistic level for wellness so that I wouldn't, traditional dentistry might have some difficulty basically giving us the right treatment plans. So even though I was a traditional dentist, I knew that I didn't want traditional dentistry at that time. So I sat in her chair. That's how I got to Katy, Texas. And she basically was sharing with me all the reasons, everything is connected. The mouth and the body are not disconnected. I think back in 1840, dentistry got divorced from medicine. We started our own specialty, and even though we were doctors of dental surgery, emphasis was not on doctors; it was actually on dental. So I ended up having a just a moment of kind of realization that everything's connected. So when I came here, I basically sat in the chair and got all of my data collections. That's our first thing that we do when we're gathering, when we meet our new patients for wellness. We collect a lot of data. So basically going through and doing x-rays, and then we do something called EAV, which is a meridian stress assessment, which kind of lets us know exactly what the body is feeling with energy going through the teeth. As you know, root canal teeth are dead, and so that was what happened to my tooth. It was not in any way vital, so I had to have that removed. And then basically now I have some things going on with my bite. So we want to make sure that our airway is good, and that everything that we kind of the foundation of our smile gets rebuilt. Yeah, so I packed up everything. I started in January this year with Dr. Katie. She's one of my amazing mentors and friends. And I just such a beautiful opportunity to work side by side with her so that I can share with you pediatric wellness and everything that's for the whole family. So traditional model in dentistry is basically, there's nothing wrong with that, except it does find a problem and fix it. So we were kind of like mechanics at some point. The mechanics of our teeth, being able to go into that dentistry was not really seen as even doctors. So with wellness dentistry, we basically get back into it. So traditional dentistry is excellent at fixing. So that was reactive, and wellness dentistry actually asks why. Both are dentistry. So the traditional dentist, there's nothing wrong, but they just weren't able to really understand the reasons behind it. So you can be a great technical dentist like I was, really, really excellent at restoring smiles. I even did root canals. I'm sorry to admit, but we were finding a problem and fixing it. And, that's a technical piece, but wellness actually asks why it's happening. The materials that we were using in traditional models were standard and everybody got the same thing. So it wasn't even an individual. Here in the wellness dentistry, we actually do what's called biocompatibility testing. So we test every single piece of material that we're going to use on a patient, from anesthetic to sedation materials to the resin materials. If you're going to be doing implant dentistry or bonding, those are all the things that you'll be tested. Each product is tested individually, and each person, you might be able to tolerate one type of bonding resin, but another type that would be a red flag for your body and put a lot of burden on it. So we had questions in traditional dentistry, which were very tooth focused. And in the wellness model, it's a whole body. The treatment is really reactive in the traditional model, whereas wellness dentistry actually asks the root cause. What is causing this and why is it happening? We don't want our patients to come back years later and have the same problem on a different tooth. What I learned from Dr. Katie is that the teeth are and the organ systems that are connected on the same meridian are actually the problems are bidirectional. So you might have decay or some disease process happening in a tooth, and that's going to affect the same organ exactly the same way on that meridian. So we want to prevent recurrence as wellness dentists. We don't want to just restore what's broken. So we want to do a discovery, and we'll talk about that a little bit later. So after 31 years, I kept asking about these patients. Why does this keep happening? I mean, that's a long time to be practicing. So I just want to re-emphasize traditional dentistry. It's not that they don't know what they're doing. They actually do. They're very good technicians, but the root cause of it is what keeps happening. They don't really investigate that at all. We weren't taught that in school. So why does the person feel worse? And that question is what led me here. So it's not alternative medicine. Wellness dentistry is based on science, and it takes into account the whole person. It asks why, and then it acts on the answers. So a dental visit here in the wellness practice, you'll find very comprehensive, which is wonderful for you. Okay, so we're going to talk about the 5 pillars of wellness dentistry. So we talked about biocompatible materials a little bit. I'll show you some slides on that. We'll go through the mouth-body connection. They're not separate. It's actually the gateway to health. We will talk about prevention over restoration. So we do restore teeth. We rebuild smiles. But we really want to prevent that from happening in the first place. And we do a whole body, whole person assessment. We talk about sleep, we talk about diet, stress, all of your medical history, everything, blood work. While we don't really analyze the blood work, we do look for certain markers like vitamin D levels. That helps know that we're going to be able to heal our bone, and also the C reactive proteins. A lot of the bacteria that come in through the mouth can cause other issues in our body. And we're definitely partners. We want to make sure that you know we are going to be your partner. We're kind of your guide through this entire process. Some people like to go really quickly if they have some major medical things happening. Other people have a slower pace based on either budget or just time. Maybe they're busy at work. So the biocompatible materials, what does this mean? So if you have old mercury fillings and you want them removed, the Protect protocol is how we here at this office do. How it's done definitely matters. So we want to make sure you're never exposed again to mercury. A lot of us, and I'm in my 50s, so a lot of our older dentists were using a mercury filling material. So it's silver, powder, and other metals, and a liquid mercury, and they mix it together. They stuff it in your tooth. You don't have to be a great dentist for that material to stay for a really long time. And what I don't love about that is it's 3 inches from our brain. Every time you chew, mercury is being released in vapor form, and it is a neurotoxin. So we do a rubber dam isolation, which is basically nothing is going to be inhaled or swallowed when we're taking those out. And I'll show you a slide of what that looks like. We do a sectioning technique. So we basically do not grind it out little by little. We actually section it so we can pop out a big piece at a time. And that minimizes the mercury vapor release. And then we also use a very high volume suction and a specialized suction that cleans the air while we're in there as well. We'd have our patients have an oxygen supplementation on. So you're always breathing clean air. And we have it isolated so you never have to do that. And then we clean up right after we've taken that mercury filling out. We do a radiograph just to make sure we've gotten all the metal out. And then we clean up everything and go on to the next procedure. So here's a picture, and I was in the on the right side. This is basically all that you see. The patient is isolated, that we have safety glasses on. This is our oxygen nose. The dental dam is there. We are wearing respirators, and that is to protect us as well from the mercury vapors. But I wanted to point out this on the right side. I was at the post office mailing a birthday card to my mother-in-law who lives in South Carolina. And look at what I saw. I had to take a picture. I was like, oh, wow, keep mercury out of the mail. So it's okay for us to be having mercury fillings, but not okay for you to mail anything like a thermometer or any kind of relay switch or blood pressure monitors. You can't put those in the mail. So I thought that was very interesting that the post office is saying finally no, no mercury. And we are the only country in the civilized world that is still using mercury filling materials. They've pretty much been outlawed everywhere else. So it's definitely not something that's okay. So let's talk about the mouth body connection. This is the science that changes how you think about your health. So there are 5 ways that your oral health is actually forming who you are. So the heart health, the periodontal bacteria, it goes in the bloodstream and you can't keep your bacteria in your mouth only. It's going to go through the bloodstream, go to your big toe, go across some of the bacteria go across the blood-brain barrier with the blood. That's super important. P. gingivalis is one of the most common gum pathogens, and it has been found in the Alzheimer's plaque. So, if you know someone who is suffering with Alzheimer's, there are some protocols that can help patients with that, either early onset, dementia, lots of things going on there. A lot of research is very active in this area. I always said plaque is plaque. So, the plaque in the arteries, the plaques in the brain, they are finding these bacteria are a significant factor causing so genetics plays part of it, but a lot of times you can find these bacteria in there. So the blood sugar as well. So if you have really elevated blood sugar, fasting insulin levels are high. Gum disease and diabetics, those are definitely bidirectional. So the bacteria get in there, they decrease the healing, and they increase your insulin sensitivity. So you end up having some issues with not being able to clear sugar in the blood. And then sleep quality is a major issue. That's one of the things I'm working on is my sleep hygiene. Probably hear about people talking about it all the time. I'm wearing a little Aura ring here to track how many hours I get to make sure it's high quality sleep. That's another thing. So Dr. Katie just got back from a biohacking conference, and wow, she just learned so much. So we're all with the blue light blockers after a certain point, and I get out every morning. I sit in the sunshine. Today I was out at lunch when I went home to have a little bite to eat, just making sure you're getting that vitamin D that's natural. And then the whole body inflammation. So if you have gum disease, or chronic gum inflammation, you are basically elevating your inflammatory load. So everything is all disease processes are basically start with inflammation. So if we can eliminate that with wellness dentistry, we can actually help the body protect itself. So your mouth is not an island. I love that statement. So let me talk about what a wellness visit looks like for you and your kids. You'll notice when you first come into a wellness practice how different it is. Before we even look in your mouth, we're going to have a conversation with you about how's your sleep quality? What type of diet are you following? And not necessarily a diet as if you're going to lose weight, but what are your foods that you like to eat? What kind of medications are you on? What symptoms are you having that you may not have thought were even dental related? Are you under any stress? How's the sleep quality? Any medications? We do a comprehensive oral systemic exam. So we look at airway, we look at your jaw function, we even actually check your ears, which is something that I can't believe that no one is doing as dentists. We have these really bright lights that we can look in the mouth and we can certainly look in the ears. We look for signs of clenching or grinding, and I'll show you some pictures when we get to the child portion of that that says, hey, it's not just cavities. We want to be able to screen for airway disorders in kids as well. The biocompatibility conversation, all of our new patients are scheduled for that biocompatibility testing, and it's a real simple test. It works with your body your body actually tells us, hey, I don't like this material. And we have a variety of very high quality materials that we customize to you individually, which is something that, like I said before in the earlier slide, a lot of dentists don't ever do that. They assume that everybody is compatible with I'm not going to pick on a specific manufacturer, but this particular composite material, the filling material that's a tooth colored. So we definitely never want to take that chance, especially when it's so important. Those restorations are going to last a really long time. So we do not want them to be in your mouth if your body is stressed out about having them there. So then we also really bring it down to where you are. We meet you where you are every time. Some patients, I had a lady 2 days ago that came and she was a patient for my entire day, my only patient. She wanted to get all of the things done that were causing her body harm. She's a mom of a few littles. And so she said, "This is my one day. My husband's available. Let's get it all done." So we did. And then another patient earlier today said, "Hey, listen, I need to take this step by step." She's a daycare owner and she's obviously very busy. This is the summertime. People are having kids come in to daycare while they're out of school. And so she said, "I can't really do a whole lot at a time." So we really customize it to meet you where you are. And we also have a really great referral network. We have our sleep therapists, we have myofunctional people, we have functional medicine providers, and we connect the dots if you don't already have your own. And that it should be something that you're asking with your providers. All of your medical and functional health providers should be talking to each other. So we definitely get involved as well. So let's talk about the pediatric window. I know that a lot of you parents are out there and you're like, "Hey, I want to come find out what should I be looking for?" This is something that the pediatricians don't really talk about with as a mom, I know I wish that people had told me about Airway and that kind of stuff. So what you don't know about your child's oral health could shape their entire health over their lifetime. So, the window for kids, the birth to 7, this is the window that changes everything. So, we'll kind of look through these a little bit on the slides here. So, birth to 2, the tongue function, it talks about latching. If they have a tongue tie, they're going to have a hard time eating. So, a lot of times that is necessary to have releases. Some pediatricians do have people in, they use a laser in their office. We do provide that service as well. So that's something that birth to 2, you really need to be looking at that because tongue ties are often missed at this age. People are already just, especially new parents, are already just trying to figure out, okay, how do I deal with this extra little person here? And then 2 to 5, jaw growth is rapid. You know how these kids are. They are growing like weeds, is what my mom used to say. So mouth breathing and palatal development are really, really important. Oral habits are pretty active. So some children are have a thumb habit, a finger habit, and you may have seen people who have, little kids will have two fingers in their mouth, and it'll kind of flare their baby teeth a little bit. So these are the times where we really need to be seeing kids. I do get questions a lot about what's the age that my kids should come in to see the dentist. We always like to share as early as possible, including when they don't have teeth. But at the maximum, you want to wait. You don't want to wait longer than when they have their first tooth. We ride in the chair. We have a happy visit. It's really a pretty fast visit and I say fast in terms of children versus adults, but thorough, just to make sure that those kids are developing correctly. If you catch problems early, it really is easier to work with the growth pattern, especially for orthodontics. We do interceptive type of procedures so that patients can, if they have a narrow palate, we can expand them so they get enough air. And the cost is a lot higher as they get older. And this slide says catching it early at a fraction, it costs less and a fraction of what they would cost if it was 35, or in my case, over 50. So 5 to 8, the mixed dentition begins. So they're starting to get some baby teeth that are loose. Typically, it's the upper front and lower front teeth that start to get loose. You'll start seeing around 6 years old, you'll start seeing the first adult molars coming in. So you'll have baby teeth, and you'll have the first adult molars, and then those front teeth around 7 will start to get a little bit loose, top and bottom. Some kids lose their teeth, like all of a sudden they have 4 teeth missing. You're like, what are they going to chew with? And that's the time where we can really see, are the adult teeth larger than the space that this child has? How are they looking? We do airway screenings, we do bite development, and early orthodontic assessment really matters at this time. That's one of the things that I think is probably underrated. And then you have the kids that are 8 to 12. So this is the sign where they're really growing. That is almost a little bit late. So we start doing developmental screenings around 7. We do it all the time, but when they start to develop their first permanent teeth, when they start coming in, and we can expand the airway in order for that to have some more room for their teeth and their airway. So let's look at this narrow arch. So you can see on this left-hand side, this is compliments of Dr. Barr. He's our orthodontist who does airway for us. A narrow palate reduces the airspace. You can kind of think of a little small room or tunnel. Obviously, the tunnel is going to have a lot less space than an open area. And you can see the wide versus the narrow arch. So, this is the same patient. I wanted to make sure you guys know this. So, after the expansion and correction, we were able to gain a lot. And this patient in the top picture, you can kind of see she's got a little tooth that's over here. Let's see if I can get my cursor. So, this is a primary tooth that's basically holding on for dear life and not wanting to leave. And so you can see, hey, I need some help here. This is also a primary canine. You can see the adult canines kind of poking through on the outside. And here's the arch all nice and wide. That is a beautiful way to have this. And then on the right-hand side, you can see this crossbite. So a lot of you parents out there, you might be thinking, oh, it's just baby teeth, no big deal. This patient actually has two adult teeth on the lower front, and she has a crossbite on that left side. So those lower front teeth are trapped on the outside, the wrong side of the road. So this is something, this patient is 6 years old, something we've already referred her to the orthodontist, Dr. Barr, for expansion. And that is one of the things that we really want to make sure parents know, even though kids are little, a lot of times it is important to do an early intervention in very specific cases. And we always screen for that too. So definitely the narrow airway just sets up a cascade of events. Basically, you're not going to have room and you're going to have a lot of crowding. So if we can help grow the jaw so that the teeth have room, that's a much better way. So early intervention is the key. And then let's go over 6 things that a wellness pediatric dentist exam checks. And sometimes these things are missed in the routine office visit in traditional. So the tongue tie, we already talked about that and how it can affect jaw development. It can affect skeletal, like how you stand. If your bite is off, your skeleton is off. It can actually affect your hips and ankles. We see that a lot in adults who did not have orthodontic benefit and didn't really have anything. So the tongue actually is connected all the way down to your big toe through a fascia. So that's something that's very interesting. So tongue positioning really makes a huge difference. The jaw and palate, and we already talked about the airway space. These are addressable really early. Oral habits, the pacifiers and either fingers or thumb habit, around 2 to 3 years old. That I always tell parents just throw it away and deal with a couple nights. Now I'm pretty hardcore. My boys were. I had one that was had a Humpty Dumpty, no finger habits. Luckily, no pacifier on the older one, but my younger one definitely was a passy guy, and we cut it, and then finally I was like, I'm throwing this away. So he was, we did have a couple nights of not happy kid, but it's worth it because it definitely keeps you from having to do a lot of dental stuff. So airway screening, is your child breathing normally? This is one of the things. Does your child sleep with their mouth open? Do you ever catch them with their mouth open? That is a sign that the airway is blocked, and we do screen the airway. Nose breathing is definitely the way to go. It helps increase nitric oxide and our oxygen. Bite development, this is one of the things we just talked about on the previous slide. If teeth get trapped on the wrong side of the road, wrong side of the arch, that is a huge problem for the adult teeth. They can actually get where they can't come out at all. They're impacted, and that can lead to surgery as an adult if it gets infected or forms a cyst. So these early bite issues are very important to address. And then the sleep signs, dark circles, restless. Some kids are bedwetting, and a lot of people feel like it's behavioral. That does have something to do with it in some children, but we've also found that kids that have been labeled as ADHD are just not getting enough oxygen while they're sleeping. And this was a really awesome thing for my kids. I have some hyperactive, my younger one, and I do feel like they tried to push medicine on him really quickly, and he does have allergies. So he was suffering from, this was before I knew anything. These are the conversations I wish I had had a long time ago. But those sleep signs are really important to screen for. And as parents, you can help us as practitioners really address that for the child. So the tongue tie, this is what we were talking about. The limits how freely the tongue can move, and it can affect the kid for decades. I see adults sometimes now that have really crowded arch forms, really collapsed arches because the tongue is just pulling so much. It's a really large muscle. And if it's tied, you're going to end up with teeth that lean toward the tongue, and then that causes a lot of issues with even hygiene. So we have in the toddler years, we've got speech delays, articulation challenges, picky eating sometimes. And then as you go through as an adolescent, you can have joint issues, some joint pain. So that's not good at all. So we always do a myofunctional therapy referral first. We know that we can correct the bite with orthodontics, but if we don't treat the root cause of that, then you're going to end up with a relapse. And that is something that I don't know if orthodontists, the traditional orthodontists, love relapses because you might pay for them to retreat you. But, we know that we want to treat the root cause. If that is myofunctional therapy and that can be resolved, that is a really wonderful thing. So sometimes it's a combination. But before we do any tongue releases with the laser or anything like that, obviously in infants, it's a little more, we do that based on feeding. But with the toddlers and school age, we can teach them how to do these exercises before we do any interventions that are procedural. Here's my little buddy. You can see the visible signs of sleep disordered breathing. So the airway and sleep, these are hiding in plain sight. We see these kids, a lot of times it's just brushed off as genetics. Sometimes it's brushed off as allergies, but allergies and airway, they go together. If your airway is inflamed because you have allergic rhinitis, you're going to have problems and you're going to mouth breathe. So mouth breathing also increases the acid in the mouth, so it can increase cavities. It changes the pH of your saliva, and that creates an environment where bad bacteria can actually live. So, definitely, if you see this in your kids, mouth open during sleep or at rest, snoring or noisy breathing, these dark circles that don't resolve after they've had a really nice sleep, restless sleep if they're waking up frequently, or bedwetting beyond typical age, daytime hyperactivity, and swollen tonsils or adenoids. We do a screening for airway. We look at the tongue and how much the airway, when they say how much airway is present, and also the tonsils. I had a young lady who was 8. She had her tonsils almost touching, and we were in the OR doing treatment for her in South Dakota, and she basically we couldn't even intubate her very successfully. So that's probably the most remarkable one that I've seen. But they really do. So if any of these symptoms, the things that you can see at home, if you have more than 2 of these, and you have them consistently, you probably need to ask your pediatrician or your dentist for an airway evaluation. The other thing that I want to mention is sometimes you'll see kids that are grinding their teeth. And parents are like, I hear them grinding and I don't understand why, or they grind their teeth at night. That is also an airway issue that we can help address. Okay, so how to raise a child to not fear the dentist. It is actually possible. Dental fear is something that kids are not born with. We, as parents, transfer those fears onto our kids without even realizing it sometimes. So, just a couple of examples. So, for me, my interest in pediatrics is to help that kid have an awesome visit. We want to make sure that they have fun, that they get a little bit of education based on their age, and that they want to come back. So, we make it a really fun time, and we always start where they are. So, we don't want to have them threatening, "Oh, if you don't do this, they're gonna give you a shot." A lot of kids get anchored when they have their immunizations. A lot of our parents don't immunize their kids in wellness in some of the wellness areas, but it's something that's a personal choice. I had immunization when I was a young child, and I definitely know that after I had that, it burns. It's actually the solution that burns, not the needle. So a lot of parents, they don't realize what they're saying. Your calm is contagious. So getting excited about the appointment in a positive way, starting early. And that's why we ask you to bring them in for a happy visit, ride in the chair. We do actually look in their mouth. We do a knee to knee exam for infants. So they're with their parent and they just fold over into my lap and I can see the development of their jaw. We check for freedom attachments, any kind of tongue tie, and then look at their teeth, of course. Never tricking or forcing them to come in. That is definitely something that can be a lifetime anchor. I had a really negative experience when I was 4 years old with a dentist who just didn't listen to me, and that kind of prompted me to become a dentist and make a difference. And then finding the right practice. So, wellness orientation, a practice that has a wellness focus, that takes time with the kids, and that can really change everything. Obviously, for a 3 or 4 year old, we're not going to sit there and ask them 25 million questions, but knowing that they are also involved, so they're able to be a participant in their treatment based on their age. So, I want to share with all of you out there. This is kind of like teaching you how to eat things that may or may not be awesome health-wise, but that it won't hurt your teeth. So, I have a brother who loves soda, and so he, as an air traffic controller, had 2 breaks in his shift, and he was trying to get all the sugar and caffeine he could get, and I said, "Oh my gosh, your teeth not only are gonna turn green from the Mountain Dew that you love, but they're gonna end up getting lots of cavities." So I said, you have to do it smart. So the 30-minute window is something that will, if you can train your child and yourself, you will be golden as far as decay goes. So we want to protect the enamel from the acid. Every time we eat or drink, if anything besides water, acid comes into our mouth for digestion. The saliva needs 30 minutes, really 20 minutes to buffer, and then that 10 minutes to be neutral. And then you want to stay in that neutral zone for 2 hours. So I always tell parents, load your 30-minute eating window with really awesome stuff. Clean protein, smoothies, eggs, high protein, crunchy whole foods are really great for kids. That helps them develop their musculature, so that pulls the jaw wider and that makes more room. So today, in today's environment, we have a lot of processed food, and processed food is generally not having to be chewed very much. So as much as you can for their age and safely, help them chew really good foods. Milk has calcium and phosphorus in it. If you don't want milk, you could do any kind of the nut milks that they have. Those are building blocks for enamel. And then a piece of small dark chocolate, I always say those are really good. And so you want to do 30 minutes of food and drink. And then that's everything except for plain water. And then 2 hours of just plain water. Don't brush right after your meal because it takes 30 minutes for that saliva to buffer. And so that you would be really in an acid environment brushing your teeth, and that would not be good for you. So plain water only during the safety zone. No flavored water because the flavored water does have a higher acid content. And as you go through that 2 hour safety zone, you're basically remineralizing the enamel, and then the saliva is just neutralizing. And so it's really nice. So 3 planned meals, 2 planned snacks, and then plain water in between. The enamel doesn't grow back, but it can remineralize if you give it the right amount of time. And so this is what acid erosion actually does to teeth. And we're going to look at another slide here. So here is this beautiful, healthy child, full enamel intact. You can see everything looks really, really beautiful. And then we can come over to this side. On the right side, the acid eroded tooth. And I'm going to point out one additional thing. So you can see where the teeth have been grinding. So this child is also an airway person. He's not getting enough air in his teeth. So you can see on the edges of these teeth, the enamel is really just eroding away. So our teeth are built in 3 layers. The enamel is the outside. Then you have a second layer that's a little softer. It's more like a sole of a shoe made out of leather. It's got a little bit of like strength to it, but it will wear down really fast if exposed. And then right in the middle is the pulp of the tooth or the nerve. So teeth are bone, but they can be affected by this acid erosion. So that's one of the things I just wanted to share with you. If you see the right slide on your child's teeth, we definitely want to take a look at them, get them to a dentist to just see what's going on. This child is probably waking their parents up grinding. You can see these flattened edges here compared to these beautiful canines that are protecting. And notice also the spaces between this child's tooth, or I should say teeth. This is making room. As that jaw grows, the teeth will start to separate a little bit more, and you'll be able to, this is so that the adult teeth will have room to come in. This guy is like really crowded. Those are going to have, this is probably going to be because of the airway as well. He's going to end up needing some type of orthodontic intervention at some point. Okay, the questions that are worth asking. So I'm going to get you to take out your phones if you like and screenshot this one. This is for your own care, for your needs. This is for your next dental visit. What materials are you using for fillings and crowns? Any dentist that will not share this information with you is probably maybe not the dentist for you. Every patient deserves to know what you're having placed in your body. Do you follow the Protect protocol? So there's another protocol called the SMART. It's not quite as protective for the practitioner, for the dentist, the team, and the patient. The Protect protocol is the gold standard for amalgam removal. So if you have those mercury fillings and you want them out, you want to have the Protect protocol. And then do you screen for airway and sleep issues? This would be something for you and also any children that you would take to the dentist. Dentists can see the signs of airway and sleep issues, but they might not bring it up if you don't ask. And then can you help me understand why I keep getting cavities? So I think if you implement that 30 minutes of food and drink and then a 2 hour safety window, that pattern of eating, you'll see a much larger reduction in cavities. But decay is a symptom of something. It's coming from somewhere. So you want to be able to understand, why do I keep getting cavities? And then do you work with other health providers? So routinely, we share information between your physician and your functional health person and your dentist. That should be shared. The blood work as well. And then screenshot this one too. Use it at every appointment with your kid's dentist. Do you screen for tongue tie and restricted frenum function? How about airway and breathing? What is your approach to early orthodontics? Some people say, oh no, wait till all the adult teeth come in. That is way too late. We want to intervene as early as possible and work with the growth that kids have. And then, do you look for signs of sleep disordered breathing? For adults too, you'd be surprised how many of our patients who take home the home sleep test find, oh my gosh, I had no idea I was waking up like 27 times an hour and that my oxygen dropped down to 88%. These are things that we see on a routine basis. So it's very important. What materials are you using in these sealants and in these fillings? We do have we don't really recommend sealants for patients, for kids, especially because of the materials that are in them, the microplastics. And sometimes they will release bisphenol A, which is an estrogenic compound. So we will do something different, but you definitely want to make sure you know what's in them. And then, do you collaborate with any ENTs or myofunctional therapists? This is super important. We see if we have a tonsil that's closing the airway, if they're growing together, or if we see inflammation in the ears or inflamed eardrum, we definitely want to be able to refer that patient to ENT or back to their primary care person if that's more appropriate. And then, what does my child's bite development look like right now? Hey, do they have a crossbite? What's going on? Are you even looking? These are things that are really important at all ages of adolescent, from birth to adulthood, to look at the bite because that is the way that teeth stay healthy. Okay, well, I really appreciate you being here tonight. If you know anyone that needs this information, please share the checklist. I think everybody who signed up for the webinar tonight will get a PDF or has already gotten a PDF. It's our gift to you. It's just basically the questions that we went through, just so that you're able to understand, hey, what do I even ask? Some of you might not even be in Texas. We are here. We do have patients that come from pretty much everywhere, but we would love to welcome you. The more families who understand what health is and the connection between the mouth and the body and overall health, the healthier our whole community becomes. So we'll hope to see you then. And then I want to plug my colleague, Dr. Min Liu. Come back next week for this amazing presentation. She's going to be talking about aesthetic dentistry, wellness dentistry through the lens of cosmetic dentistry. She's a digital smile design master. She instructs courses at the Wellness Dentist Institute. She takes this work very seriously. And what I love most about her, she understands that a beautiful smile and a healthy smile are one and the same. It's the same goal. Hope you join us next week. It's Wednesdays, 6 p.m. And you can just figure out how wellness dentistry can improve your health and your appearance as well. Okay, so these are the ways that you can experience wellness dentistry for your whole family. If you want, you can book a wellness dental visit. You could read the wellness blog or follow me on Instagram at Dr. Caroline Jones. All of these are awesome resources, and we would love to have you join our community. And do you have any questions? Yeah, so PA, thank you for sharing your experience with having the mercury fillings removed. I did as well. I did not do the Protect protocol because I didn't know about it. But I'm very glad that I don't have mercury 3 inches from my brain. Biological periodontist in Utah. Maya, we will definitely get you someone. If you could drop a direct message for us, we'd be happy to share that person. We would probably connect you with a biological dentist in Utah, and then they would refer you to the periodontist. We have Dr. Rosalie will be doing a webinar 2 weeks after the week after Dr. Lou. So definitely tune in for that. And she may have some colleagues that are in the biological thing as well. How long is the initial visit? Oh, thank you, Dr. Katie, for answering that question. I appreciate that. Coming from out of state, how many days should I book? We can definitely give you some information about that. We have patients that come sometimes depending on what you need, and I appreciate you dropping the number in there. Do you do any dental medical necessity? I'm not sure the question. I don't understand that one. So we do comprehensive dentistry, so A to Z, from ceramic implants to full mouth restoration of all kinds. So I really appreciate that question. Hopefully, Marla, I answered that for you. If you want to, you can give us a call back and give us a call and let you know. And let's see. Thank you for all the love. I appreciate that. We don't have a team in Broward, Florida, Rose, but we would be more than happy to connect you with a wellness dentist there. And wellness dentistry, we know it's a spectrum. So we focus on, we have a biological periodontist, we have wellness dentistry. I'm a wellness dentist and I focus on pediatrics mostly. I do see adults and I love, I'm a general dentist. So I love seeing everybody. I just have a deep heart for kids and helping them feel comfortable in the chair. And then let's see. Meridians can be reestablished? This is a really awesome question, Maya. So, every single time that we remove a diseased tooth or a dead tooth or one that is fractured, we do a meridian EAV assessment. So, we make sure that that body is going to heal. So, you might have heard of cavitations or CSR, covered socket residuum. If you do have something like that and it's determined by the meridian stress assessment and the CBCT that goes to the radiologist, if that is indicated, we remove the tooth and then we measure, is that energy flowing there, yes or no? We make sure that it's 50. So we know that your body is going to heal properly the next time to get rid of that. So yes, the meridians can be reestablished if that's what you meant, reconnecting the tooth meridian to the rest of the system on that line. PRF, yes, we do. Merjam, I don't know if I said your name right. We do have PRF. That's awesome. And it's amazing to me. It's your own body. And so our bodies love that. It's a great way to make sure healing happens without any foreign materials. So that's wonderful. We do actually see kids with special needs. It depends on the needs. We do have a lot of partners as well who are pediatric dentists. So, depending on the age of the child and what kind of situation they need to protect it, to make sure they're protected, absolutely. We would love to talk to you about that. You could email us if you'd like. That would be something just to kind of personalize it so you don't have to put everything in the chat. And we'd be happy to take a look and reach out to you. Personally, I can reach out to you and just find out what the specific needs are, but we do have some. Let's see. Biodentist in Iowa or Illinois. That's for Melissa. Melissa, that is a great question. I don't know who is up there at the moment, but we can certainly find out. Just make sure we have your information we can share with you. Maybe someone, Dr. Katie, might know someone up there. Santa Rosa, Sonoma County, and San Francisco. So this is for Michelle. Yes, we have lots of biological dentists in California that are recommended by us. Super nice people. And then we also can thank you, Rayla. She's one of our team members. Thanks for chiming in. So Rayla said, if you want to see if there's a biological dentist in your area, you can go to the IABDM. So that's the International Academy of Biological Dentistry and Medicine, and that's .org. So that's their website, and you just put your zip code in, and it'll show you what's available in your area or close by. So that's a really good way. So, Maya, you're asking about cavitations on all four wisdom teeth. Where does the bone grafting autograft come from? So, that depends on the patient. We actually typically will do a mineral bone. And that's something, if you do have cavitations, there are some nuances there. You want to make sure, just because it's read as altered bone healing, that it really is necessary to do the surgery. So, just because you had four wisdom teeth out, for me, for example, I had four wisdom teeth out. Only two of mine had a cavitation that needed to be treated. So even though the radiologist saw four, there were altered bone healing, is what they call it when the radiologist reads it. And then Dr. Dawn Ewing, who is doing our EAB assessments, the meridian stress assessment, to make sure that that energy is flowing. Two of mine out of the four needed to be treated. So it does make a difference. Yes. And then let's see. Medical conditions affecting the teeth, osteoporosis referrals near Boston. So iPhone, I think you just type this in. Again, I'll refer you back to Rayla's note there, the iabdm.org. That might be a great resource for you up in Boston. We do have some biological dentists that we know up there. So if you want to just go on that IABDM website, that should be helpful to help connect someone to you. All right. Well, thank you so much, you guys. I really appreciate everybody coming out. It was a pleasure to host this webinar tonight. Thank you, Dr. Katie, for letting me share what I know about pediatric dentistry and wellness. And we'll see you guys. Don't skip Dr. Lou's presentation next week. You'll love it. So we'll see you next time. Okay. Thanks.